Good morning, YouTube, and welcome to Cycle 5. This is another day in the life of a pharmacy student. I'm going to be taking you on a typical day of my current rotation cycle, which is Robert Wood Johnson Hospital, and I'm rounding in the ICU. So it's a critical care rotation. It's one of my clinical rotations with a faculty member, so we have a lot more projects, and these are typically our more intense rotations. So that's where I'm going to be today. But I'm getting up at 2 because my rotation starts at 7:30 every day. So I typically like to get to the gym around usually around 3. So I get my breakfast and stuff. The gym is like 15 minutes away. I got a 24-hour one, which I'll be showing you. So I like to train probably like 3-ish to 6:30, around that area. Or if I get there a little late, I'll finish up at 7. Then I gotta drive over to rotation. We have like a parking lot, take a bus over to the hospital, and then I'm there on time. So right now, just having some breakfast, having the typical stuff. We got 2 cups of coffee with some protein in it, and the beautiful Lucky Charms. And then I'll probably have some of these, which are really seasonal, and that I suggest, if this video is out in time, take advantage of these. These are pretty much just candy corn in pumpkin shape, but they taste so much better than those little triangle candy corns. And since Halloween just happened, I picked those up instead of $2.50 a bag. They're only $1.40, so of course I picked up 5 of them. Shout out to Brandon. He's the one who got me onto those. But I'm probably just gonna eat this up, then head over to the gym in like 30 minutes. It's Tuesday, so I know a new episode of Ball in the Family is up, so I may watch that while I eat, and then we'll head over there. Apparently Ball in the Family is done its first season, so I guess I'm not watching that this morning, so I'm going to be watching the diet break video from Lane Norton, so I'm checking that out right now. And then after I finish my Lucky Charms and stuff, then I'll probably head over to the gym and get training. But also, Nicole should be joining me, so I think she's heading up soon, but we'll see. Look what just came in the mail. Well, it probably came yesterday, but look what I just opened in the mail. This is the Nova Nutrition's Epoch Alpha pre-workout. So I'll be using this in days to come. I like it because it has sodium. It's like 1 gram of sodium in here, and then a good amount of caffeine, citrulline malate, and also a full serving of leucine. I got some pre-workout because some days that train at 3 a.m. During this rotation cycle, but I only do that typically for my squat days because I usually, most of the time, will be okay squatting at 3 a.m. and not lose too much strength. But I noticed last time I tried deadlifting at 3 in the morning, it didn't go well. I could barely budge 5 plates. So I remember, I think it was either that day or just the next deadlift day, or one day I just had to lift afterwards, after work, and I deadlifted, and then I was moving some good weight. So now I'm doing my deadlift workouts when I get done rotation around like 4 o'clock. So that's why I got this. It's for my late deadlift workouts, but I may also start using it in the morning. But if I do that, I don't want to overdose on caffeine or just get too jittery. So I'll probably replace my morning coffee and just have decaf and take the pre-workout. So instead of like 1 gram of caffeine, I'll still just get like 400 or 500 grams. So that's the move for that. But yeah, I'm about to head off to the gym. Good morning. Only 24/7 gym around. So this is Diesel Gym, which we joined because it's 24 hours. I think it's Tuesday through Friday. So usually you can come here at like 3 in the morning and it's open. So we joined here, I think it was like $50 for 4 or 5 weeks. So that's why we joined here. I like the gym, but it's just really, really cluttered because there's a lot going on. It's a bodybuilder gym, so there's a lot of different machines and things to do. But I'm just here for the squat rack. I've also been feeling terrible in the last couple weeks, so I'm taking a deload. So hopefully I have 4 or 5 on the bar. It should be a pretty quick single, and maybe 2 back offsets, so something light. Definitely taking a decrease in volume this week, just so I can hopefully feel a little better with squats, because it hasn't been pretty lately. Deadlifts are moving, but squats are hurting. So we just finished up at Diesel Gym. There's it in daylight. Saw the gym, a little cluttered, but I love how it's 24 hours. And they got Ohio Power Bars, so really can't beat that at 3 a.m. So right now I'm gonna drive over to RWJ. We have a parking lot and then we take a bus over to the actual hospital. So my car is currently stocked. Stopped at Costco yesterday. Got 3 boxes of the protein bars. These are the ones that I get. The protein bars, they got fiber in them and stuff. And then I picked up some more of this protein. Again, that's 6 pounds for 40 bucks, so cost effective. And so I'm gonna have a protein bar. And then I also got one of these, there you go, inline marshmallow treats. I did a review on these before and I thought they were just okay. I think they may have, from what I was told, they fixed up the flavor a little bit. But again, they have a high calorie load at like 275 calories. But because I'm bulking, I love fitting these in. So gonna eat one of these and one of the Costco fiber bars. I usually have like 3 or 4 of those a day, but we're gonna drive over now. All right, so we made it. For RWJ, because it's there's so many students and like doctors and everything, we actually park in a nearby church, and then we get these shuttles over to the actual hospital. So let me show you those. Actually, it's pretty far, but way over there. There is one of those, but I'll show you as I get on. I'm just gonna get my stuff on, and then we're gonna get a move on.
You can figure out ways of transferring.
Here's one of the other students, and probably the best looking male student. This is Wakas.
What's up, guys?
So we've been surviving the past few weeks, and we got one more student, so we're both about to head in soon. Cool. So we're ready to go. I wore my best shirt from State and Liberty for today. We got Wakas on the camera. But with these protein bars, because like I've got a jaw workout in the car, when they're in your car and it's really cold, if you can hear that, they're really, really hard, so definitely let those like defrost a little bit. But we're about to head in. I told you I typically eat like 3 or 4 of those. I'm bringing 2 for lunch, so I'll probably eat one of those in like an hour. And then I also have a scoop of protein that I put in a little funnel. So I'm gonna be having that later. Me and Wakas are gonna get in the van and then head over, and what we do first is work on patients for when we round in the ICU. So we pick a patient and we have to know everything about them, what drugs they're on, what things to monitor. So we go in there like an hour and a half before rounds and get that done. So we're gonna head over there, take our notes, and hopefully avoid a roast if we don't know our stuff. So we're going. MVP arrived! Say hi, oh mama. She knows everything. She's the legend. She saved me and Wakas's life so many times when we were taking a roast. So we're gonna get in the van now.
I'm down.
Good morning.
Good morning. Hi, how are you?
Good morning. Hey, Dan. There he is.
Yo, what's up?
How you doing, my man?
All right, how are you?
Good. I'm guessing it's this one. Oh! I lose. That's my man. Good morning.
Good morning.
Yeah, because that's the thing, is like, I remember
For computers.
Thank you.
Okay.
So we're in the conference room right now. I worked up my patient on one of their computers because it's the only way you can get into their patient system. So I worked them up, not many changes since yesterday. And also today is a special day because we have this thing called a smart rotation. RWJ has a lot of preceptors and a lot of pharmacy students because typically a preceptor is 2 or 3 students. There's a total of 15 of us, and I think there's about 5 or 6 preceptors. So what we do every week with this smart rotation is there's a topic picked, like say diabetes, and then each group of students takes a certain topic of the topic, the bigger topic. So today we have toxicities and we have other toxicities, which is kind of ambiguous, so we're just going to be picking some random drugs. I think we did cocaine, crack, and what else are we doing?
Meth.
And meth, so some fun drugs. And we're going to see what the toxicities are of those. So when we all meet together, that's at 10 a.m., we're going to be presenting what we put together. The awkward thing about that is rounds start at 9 a.m. We get here at like 7:30, work up patients, then rounds are at 9. Rounds are, we pretty much visit each patient bed and we go over what their treatment is, things that we're monitoring, the plan for the day, and the overall goals for each patient. That's like us 3 pharmacy students, our preceptor, we have some med students, there's a medical fellow, and then there's the attending, and there's also a nurse practitioner. So there's a big team of like 8 people or so going to each room and then putting together their care. So that usually takes 2 to 3 hours, which is pretty crazy, and that's a big chunk of our morning. Usually we go to lunch after that, but today, since this is at the smart rotation is at 10, we're kind of putting it together right now, and then we're gonna send it over. We're gonna print it out and then present that at 10, so we may actually not be at rounds today. But that's a typical day, what we do here. So for right now, since I already worked up my patient, if our preceptor asks us about our patient, we have to present the case and everything that we're monitoring. And that may be later today or sometimes, but for now we're gonna get the smart rotation done, get our presentation ready for that, and hopefully do well there. So we finished up our round. We just did a really quick one. Usually it's like 2 or 3 hours, but we got out after about an hour. Wakasa's chowing down on a protein bar. And then so we're gonna head out, print out our smart rotation thing, and then we're gonna give a presentation on toxicities. So each group is gonna have something prepared, so it's usually 1 to 2 hours. And then after that, we have lunch, but we also have a presentation that we're giving our preceptor today, so we gotta prepare for that. And we're probably gonna have our last day of case presentations, so we really gotta cram some knowledge in our brains.
Have the most intel on what he's feeling like today. This is Kavita right now.
Yo, we vlogging.
Getting
we
this
in
work
Cycle
done.
5. Life of a pharmacy student.
Big Z with the
Big Zizito.
Kevito.
Right now he's trying to print our stuff frantically.
Mi gente.
Before, how do you zoom? I'm trying to zoom on.
Turn
The
the
zoomito.
I was trying to zoom on your swollenness.
zoom right there.
The swole.
Yeah. I'm doing one today. Well, guys, this is my film guy.
Yeah, I'm
Wackus.
a photographer.
I'm paying him.
He compensated me in protein bars. He really did.
Smart rotations. When you run out of staplers. Alright, so we just finished up our smart rotation. We got kicked out of our first conference room, and then we had to go back over across the street and then do the rest of the presentation there. We're crossing the street, so try not to get hit. 2 close calls. But now we're gonna go take lunch and work on, we are presenting a seminar tomorrow on nephrotoxicity and vancomycin and zosyn, antibiotics commonly used in the ICU. We're presenting that to the fellows and other med students tomorrow. So we're presenting it to our preceptor today, so we look good tomorrow. So we gotta make sure we finish that, make it crispy, and then we also have to make sure we know our patients really well, because we're almost done this rotation, so we're probably gonna get some questions on that and a nice roast before we're done. So we're off to lunch now. Alright, so we made it to 1 o'clock. We're about to meet with our preceptor, and we're gonna be going over the seminar that we've been working on that we're presenting tomorrow to the med students. So we're pretty much kind of sort of getting graded on it now with our preceptor, and we're gonna give a presentation of that, and then also we're probably going to go over cases with our the patients that we picked up. So we're going to be talking about their medications and what to monitor, and we're probably going to go in pretty deep with that. So we've definitely been working up on that because we're probably going to be graded. So this is what we're doing. Our seminar is based on the incidence of vancomycin-induced nephrotoxicity in the hospital ICUs. So here's part of the literature review that I'm going to be going over. I think we have like a 30-slide presentation, but I just printed out my stuff. So we're about to get that underway and get that started. Hello. All right, so we're done for the day. Just finished up. It's about 4 o'clock, so came in around 7:30, leaving at 4. Some days we stay longer, some days we get out earlier, so not too bad. So we went over our seminar. We did a quick run through, so we're ready for tomorrow, and then we went over our patient cases, the patients that we picked up. In going over those, we did okay, but each of us got a few questions where we can't answer, because typically when you go over your patient case, you tell the medications, the monitoring, and it's like, why that? Did you check these guidelines? Did you check this lab value? So there are going to be things you're going to miss, so it is pretty tough, but as you go on with these, you get better at it. Day 1 I was terrible, but week 5 I'm better than terrible, so improving. But the plan for now, because we gave up lunch to put finishing touches on our seminars and cases, since I didn't get a chance to check on my clients during lunch as I usually do, I was considering going to Starbucks and chilling there, but seeing how it's all rainy and not the best of days, I'm not going to want to get back in my car, so I'll probably just go to Nicole's house, post up there and get some work done. So I'm going to drive home, and that's the plan for the rest of the day. I talked to my preceptor for the interview. She wants to do it tomorrow morning as opposed to today, so I'm gonna put that video right here. All right, guys, so I'm here with my preceptor. This is Dr. DePauli Disket. See? Already can cut that out.
All right, delete.
All right, take 2. I'm here with my preceptor, Dr. DePauli Dixit. That's take 2. But so yeah, I want to ask you a few questions. So this is week 5 of our rotation, so just finishing up.
No, you're done.
Well, now we're done. We're done. So Dr. Dixit is a clinical pharmacist at Robert Wood Johnson. So I'm gonna have her tell you what she does. So Dr. Dixit, what do you do as a clinical professor at Robert Wood Johnson?
Okay, so I would probably divide that into 3 different buckets as to exactly what I do here. So I would start out by saying, number 1, I'm an educator. So educator, which relates to you guys. So I'm here to, make sure that the students that come on rotation with me for 5 weeks on their experiential rotation. So I basically work in the intensive care unit. So education for them, in addition, education for the medical residents, medical fellows, as well as nurses, APN, so essentially all the disciplines that are involved in taking care of our patients. So I do a lot of education for everybody. Aside from education, I also have clinical responsibilities. So what that entails is essentially rounding with the intensive care unit team every day. And my role predominantly is to make sure that my patients are on the optimal pharmacotherapy. So what does that mean? That essentially means that I make sure that they're on the right drug, they're on the right dose, right duration. I always make sure that I'm checking up their monitoring parameters depending on what drug they're on, check for drug-drug interactions. So essentially that's my role when I round with my ICU team. And
we're in the ICU, so there's many comorbidities that are going on at once. So
and comorbidities translate into tons of drugs that they're on.
So they have lists that are 10 to 15 drugs long, even more sometimes. So she definitely keeps busy on those rounds.
Yeah. And then the other thing that I do is I'm also involved in various committees at the hospital. So what that means is I work collaboratively with our other disciplines, so whether it's nursing, physicians, whoever else is on the team, or the committee for that matter. We develop protocols, and then we figure out how to go about implementing them. So that's also part of my responsibility. And I would say lastly, if there's any time left aside from doing my clinical responsibilities at the hospital, and then teaching at the school, I also sometimes go to the asthma clinic that we have here right at the hospital. So my role there is essentially conducting education for our patients that have asthma or COPD. So I would probably say
pretty busy, pretty loaded schedule.
Super busy.
Yeah. Yes. So Dr. Dixit also, I've been in the pharmacy. This in the pharmacy school. This is my 6th year, so we've been doing lectures for, I guess, the past 3 professional years. Dr. Dixit has given us a lot of lectures, and I know many of my, probably people watching are younger pharmacy students. Your professors aren't just teaching classes. They're doing research, they're doing things that Dr. Dixit is doing.
Oh, that's another thing that we have to do here, is also be involved with different scholarly activities. That means conducting research, writing papers, and doing many other things. So we're super busy.
Yeah, so she keeps very busy. So if you want to be a clinical pharmacist, this is an option open to you if you like teaching, research, and just being in the hospital. So again, I've been here for 5 weeks, me and 2 other students. So I guess tell the
we had
viewers.
some fun together, right?
Yeah, had some fun.
We've had our moments.
So I guess what kind of like assignments and what do your students do with you during the rotation?
So the students' primary responsibilities are on rounds. So essentially, they're going to be doing what I do on rounds, right? So when they're basically responsible for following patients in the intensive care unit. So they have to make sure, again, optimize the patient's pharmacotherapy, right? So that's what they basically are responsible for doing. In addition to that, they get a lot of drug inquiries from the physician. So, some question will come up about a drug. So then the students, you guys, go do your little research, and then the next day you come back and present your findings to the team. Mm-hmm. So that's another part of it. So again, education for the team, following up on patients. When we have time, then they end up going to the clinic with me as well. What else have you done?
We had a few projects that we did.
Tons of projects. Lots of presentations for the physicians, as well as...
Today we presented our seminar.
Journal club, case presentation. So they're actually super busy on my rotation as well.
Yeah, we keep busy.
And whatever else comes up, like one day my attending will decide, oh, we need to do this to Polly, and maybe your students can help out with that, which is what happened with our inhaler education thing, right?
So we had to learn inhalers really quick, and we had like 10 different ones. So, but I mean, that's good. That's going to translate over to the community setting and just anyone working with patients.
And that's one of the reasons why I decided that, I wanted the students to have a versatile experience while they're here. The other thing you guys got to do was to watch... placement of an extraventricular device too.
That was really cool.
So they have an opportunity to watch different procedures that take place in the intensive care unit as well, which is something that they won't see once they leave here. So I think that was it, right? Yeah,
that was pretty much it for that. So we both keep busy during this rotation. And then I guess for those considering the clinical pharmacy path, what made you choose clinical pharmacy over community or staff hospital?
So I would say I actually did community pharmacy for some time. So my career was a little different than...
Yeah, usually people do PGY first.
Right. So I actually, when I graduated, I became a community pharmacist, and there were some personal reasons why I ended up doing that. But I knew deep down at some point I was going to pursue clinical pharmacy. It was a matter of time. So when time permitted or circumstances permitted me, I went on to pursue a PGY1 in Michigan, and then I did a PGY2 in critical care pharmacy. And once I was done with all those training programs, I ended up working as a hospital-based clinical pharmacist in the intensive care unit at St. Barnabas. And the reason I did that, I always wanted to teach at some point, but I thought I would be a better teacher if I had some clinical experience. So I ended up doing that for a couple of years, and then after that, I ended up pursuing academia, which is what I always wanted to do, and it's because my entire family is in academia. So,
okay.
So it was a matter of time. It took me a little bit longer, but...
You made it to where you wanted to get to, and we all have our own questions that we want answered, and as we were talking today, people have different goals. Like some people want to know the best ICU therapy out there and want to do research there. Some people want nutrition answers. So we got to follow the questions that we want to have answered, especially if you have the opportunity to pursue academia.
Yeah, and I think the best thing about doing what I do is the versatile experience and the opportunities that are presented in the area that I'm in. There's just so much we get to do.
Yeah.
I get to teach, I get to do research, I'm a clinician. where else are you going to get all this, right? So.
Yeah. So being a clinical pharmacist, you get to do many different things, and no day gets really ever the same.
Yep.
Yeah.
Yep.
So
Keeps me going.
So I just want to say thank you to Dr. Dixit for especially our 5 weeks. We learned a lot during this rotation.
It was a pleasure having you, Kevin.
Thank you. And I guess on to the rest. All right, so now I'm all caught up on my work. I want to go over like what a clinical rotation is, or the rotation that I'm currently at. So this is a clinical rotation with faculty members. So on these, I have a faculty member, which is my preceptor. So Dr. Dixit is, she works for Rutgers. Also does lectures for the school and for our class. So with this rotation, we have a certain amount of projects that we have to get done. So typically I think there's 3 or 4. Commonly you'll get a journal club, which is when you do, there's a kind of a format that we fill out, and we just pretty much really go into like a study, check out like a research article. We go through it, we break it down, strengths and weaknesses of all parts of it, and then we present it to our preceptor. Another project we typically get, we had to do a journal club. You typically will get a case presentation where you take a patient case and then you have to present that to other students, your preceptor, and maybe some others. For us, since we're running the ICU, we're always following patients. We're picking them up as they come in and out of the ICU, and then we find out prior medical history, all that stuff, and medications, and we go over that. Formal case presentations, which you typically do, that you would hand in. And that's typically, you would get a patient, follow them from like day 1 until however far, and then you present that to your preceptor. We didn't have to do that because we did a inhaler presentation instead to the fellows, so we showed how to use, because there's so many different inhalers nowadays, we showed how to use those. So that was, instead of our case presentation, like a formal one, we just did that, and we're also doing inhaler clinics for patients. The other thing is a seminar. Usually you'll do like one based on a drug product, like a new medication. On my first rotation at Monmouth was one of my other clinicals rotations. So then I did mine, I think it was on a drug and its use in weight loss. And then I went over clinical trials in that. So for this rotation, we are doing our seminar on drug-induced nephrotoxicity with vancomycin and Zosyn, so 2 commonly used antibiotics in the ICU. So we're presenting that tomorrow. We presented it to our preceptor today. So those are pretty much what we're going to be graded on, and then just how we have been presenting our cases throughout, how much input we've been putting into rounds to the team, and that's pretty much what we're going to be graded on. So without a doubt, so far this is by far my hardest rotation, just because we're in the ICU and you're going to have complicated disease states there. You don't get, like in my mental health rotation, that was my other clinical one so far, it would always be like one of like 3 diseases, like bipolar, schizophrenia, or depression. But in this one, that's always going to be like prior medical history that we're still going to have to treat in the ICU, in addition to some very important problem, and then they probably get some kind of hospital-acquired infection. So there's a lot to go over. There's a lot that can be asked, and there's a lot of guidelines we have to read. So it's very hard. Some of these these case presentations that we have to do are very difficult because there's so many things to pull from, and it's hard to know all of it. So definitely very challenging. I'm learning a lot, but I'm very excited that this is our last week. And then we'll see if any of my future rotations can compare to this one, because it has been tough. I've had a lot of 9-hour days, but we're moving along. Just want to tell you guys what a clinical rotation is, why they're more difficult. It's just because we have those projects, we go on rounds, and clinical pharmacists have to know a lot of information because they're in the hospitals. They're giving a lot of input. They're working with doctors, so they're reading up on current research, the newest studies. So I'd say clinical pharmacists have to know probably the most, because they're treating patients. They have to be on the cutting edge for the most part. They're often also teaching on the side, teaching students, and also doing research on their own. So that's the premise of this rotation, and trucking it along last week. So just trying to bang it out. Hopefully we present this seminar pretty well tomorrow. Get a good grade.
What's
going on? What's going on, dudes?
Hi, Nate.
Yo.
Alright, so I guess that's going to do it for the video. Finishing up my macros with some red bean ice cream. And then the goat, some of these mellow cream pumpkins. So thank you guys for watching. I hope you enjoyed this video. Hope you got something out of it or got a little insight into my life and what I do on rotations. So that's it for the video. Thank you for watching, and I'll see you guys in the next one. Peace.